Hi everyone, this is your podcast for crisis intervention. I want you to be thinking about a time in your life perhaps that you experienced a crisis. And I can think of some examples from a national perspective. 9/11, Hurricane Katrina, Hurricane Sandy. There's many others. What is a crisis? It's an internal disturbance resulting from a stressful event or a perceived threat. A turning point in a person's life, a point at which the usual resources and coping skills are no longer effective. A person enters a state of disequilibrium. Crisis occurs in the lives of all individuals. Precipitating events can be a perceived loss, threat of loss, or a challenge. Can usually be identified. The event can have occurred several weeks ago or within the past few days. Again, everyone has troubled times. Sometimes it can be a serious crisis like personal loss or death, physical loss as in losing your possessions to flood, psychological loss, or even as simple as change in routine depending on the individuals. Some characteristics of a crisis. Crisis, again, occurs in all individuals at one time or another and is not necessarily equated with psychopathology. Crises are precipitated by specific identifiable events, as I've said before. Crises are personal by nature. Crises are acute, not chronic, and are resolved in one way or another within a brief period. A crisis situation contains the potential for psychological growth or deterioration. Most crises will resolve itself in some manner within a period of time, usually a few to 6 weeks. They can precipitate, though, or be a consequence of mental illness. Strong evidence that more specialized 24-hour crisis response services are needed for those with mental illnesses and their families. So, what makes a crisis a crisis? How the event is perceived. Does the individual see this as a crisis? How have the experiences in the past been coping with a crisis? How did the individual cope in the past? Did it work? Who or what helped them? What is the usual coping ability? And support systems. A person who lacks support systems is more prone to take perhaps a small event and make it into a crisis because they don't have those people around them to hold them up. How you react to a problem is a turning point one way or another, for better or for worse, but a change. Crisis can be a non-emergency or it can be an emergency situation which is life-threatening and demanding an immediate response. In crisis, you will see the individuals overwhelmed. Communication is decreased. Use of healthy coping skills is decreased, and the person may undergo increased isolation. The Chinese character for crisis equals 2 symbols: opportunity for change, growth, and learn new ways to cope and problem solve, or danger. So it says, these 2 symbols, crisis is danger and opportunity. Some reactions to crisis. Crisis in any event is a threat to homeostasis. During crisis, the magnitude of the problem and the immediate resources available to deal with it are imbalanced, resulting in confusion and disorganization. What may follow, or what may occur following the high anxiety that accompanies crisis, people can, as you can see on the slide, they can adapt and return to the previous state of mental health. That's a good outcome. They can develop more constructive coping skills. That is also a good outcome. They may decompensate to a lower level of functioning, and that is not a good outcome. Some factors which influence the outcome of a crisis: previous problem-solving experience, perception or view of the problem, amount of help or hindrance from significant others, number and types of past crises, time since the last crises, membership in a vulnerable population, sense of mastery, and something called resilience. Resilience is a person's ability or wherewithal to withstand a crisis in his or her life. Some phases in the development of a crisis: exposure to a stressor. Problem-solving techniques do not relieve the stressor. Anxiety increases. Every resource is used to relieve the stressor and feel better. If resolution has not occurred, tension mounts eventually to the breaking point and major disorganization occurs. The person may feel helpless and confused and may see themselves as a failure at everything they do. Here's a little kind of picture, if you will, of a crisis situation. You've got the crisis stimulus, and then you have mounting tension. Then you have stage 2, which is a plateau of disorganization and maximum tension. Stage 3 is mobilizing those resources. Stage 4 may be major disorganization or maladaptation or pseudo-adaptation. Stage 4 may result in adaptation and crisis resolution, and that would be the ideal outcome, and equilibrium is restored when that happens. Anticipating that there might be a crisis and preparing for unpredictable events like changes in developmental stages, natural disasters, death. Sometimes our reduction is through our preparation. Maybe redefining or changing goals. Sometimes plan A doesn't work out. We got to go with plan B. Developing communication skills is important. Seeking help. Intensive support as close to the crisis event as possible. When in a crisis, a person may feel disoriented, confused, with decreased functioning in thinking, work habits, etc. Relationships can be tense. The person can be irritable, depressed, and moody. So, crisis situations, developmental or maturational. These result from normal life events that cause stress. When you think about life changes, starting school, puberty, leaving home, graduation from school, marriage, pregnancy, childbirth, middle age, menopause, retirement, facing death of others and self, the factors that help adjust a person through life changes are desire to change, agenda for life courses, accomplishments in the present era, past success in coping, support at these times, examples of how peers have coped with similar situations. When a life event upsets an individual or group, like natural disasters or loss through separation, divorce, death, or loss of job, money, valued possessions, job change, addition to the family, hospitalization, institutionalization, rape, suicide, homicide, imprisonment. These are all examples of situational crises. Situational crises develop as a response to sudden and unavoidable traumatic events that dramatically alter a person's identity and roles. An adventitious crisis is where outside external events cause trauma and disruption, usually to many people. It results in many losses and significant changes like destruction caused by hurricanes, tornadoes, other disasters, environmental disasters, and so on. So you'll see many types of crises. A woman experiences extreme anxiety and depression when her husband of 20 years dies in a car accident. What is the term for this type of crisis? This is a situational crisis. B. Usually follows loss of established support and disrupts the usual ways of presenting the self, threatening the self-image. So, healthcare professionals can help patients and families prepare for possible maturational and situational crises. Some strategies include helping a person analyze the stressful event, express their feelings, explore ways to deal with stress and anxiety, problem solve with them and identify actions and strategies. Help them seek support from family, friends, and community resource groups. Avert possible future crises through something called anticipatory guidance. If you have had little kids, for instance, and you've taken them to the pediatrician, and at certain well child checks, the pediatrician or the nurse have discussed with you, like, okay, kids getting ready to turn 1 and enter kind of that toddlerhood where they're really mobile and getting into things. So they might talk to you about poisons, poison control, and that sort of thing. That's anticipatory guidance. It doesn't mean that your child has experienced that yet or done that, but they are anticipating that there could be a problem in that area, so they will teach you about that problem or talk to you about that before that problem comes up so you can take the appropriate preventative strategies. There are 10 tips for crisis prevention in nursing, Spotlight 35-1. We'll do a little work with them in class. Crisis interventions following adventitious crises. Remember, these are those like floods, hurricanes, 9/11, for instance, just these crises that involve many, many people. It's called psychological first aid, is how we help these people. But basically what happens is there's an early mental health assessment based on a hierarchy of needs. We will triage. We will orient the survivors to immediate local services, and we will communicate with friends, family, and community. Psychological first aid is a natural recovery method that focuses on resilience rather than psychopathology. People are encouraged to use natural support systems at their own pace. Symptoms decrease in normal natural recovery. Acute stress and PTSD can actually be outcomes of adventitious crises. Crisis intervention, the immediate goals are to assist the client to resolve immediate problems and regain emotional equilibrium. Longer-term goals hope to help the client adapt to the situation and help the patient return to normal functioning. Crisis intervention can be a walk-in or telephone contact, like a 24-hour service. And again, we'll do a little work with some crisis intervention in class as one of our activities. Suicide is a crisis situation. Focus crisis counseling with a suicidal client. You want to focus on the current crisis and how it can be alleviated. Note the client's reactivity to the crisis and how it can be changed. Work toward restoration of the client's self-worth, status, morale, and control. Introduce alternatives to suicide and rehearse more positive ways of thinking. The ultimate goal is to assist the client in developing more effective coping skills and to encourage a higher level of functioning. The nurse is an active participant in solving problems, but you do not take over or make decisions for the clients unless there is a safety issue. You draw on the skills they have or can learn to help them cope. Behavioral skills, like the actions they're going to take. Affective skills, management of feelings provoked by the event. Spiritual skills, meaning in and understanding of events. Cognitive skills, helping the person to cope with a situation. And psychosocial skills, or helping them manage relationships, are all important. They might use a defense mechanism called denial, and this is an effort to protect themselves to temporarily cope until they can move on past the crisis. Some treatment modalities, again, crisis intervention. They can be support groups or one-to-one, like one-to-one individual psychotherapy where there's a therapist and a client. The relationship here is focused on changes in feelings, attitudes, thinking, and behavior. Group therapy, a therapist or leader and group share common purpose. The members contribute to the group and expect a benefit. We can use psychotherapy, family therapy and education, support, and help the members cope with common problems, or self-help, common experiences, and no identified leaders. So there's many ways of getting a person help with crisis and crisis intervention. And again, we shall talk about 10 tips for crisis prevention, and then look at crisis intervention services in Lancaster County in class this week. And that's the end of your Crisis Intervention Podcast.